to the cloud. All right. Hello, OT geniuses. So I tried to go live earlier this evening, but it was just being very, very weird. And even though we were doing things correctly, it wasn't letting Dylan on. So we are making this video, and if you have any questions as you're watching this interview, please do not hesitate to put it in the comment section, and feel free to reach out to me. And Dylan also is in the group if you want to reach out to him with any questions as well. And I hope that we provide you guys with a lot of input as to what it's like to be a travel therapist, and because that's one of the things that I know that as a pre-occupational therapy student I did not even know was possible or existed. And so I want to make sure that as pre-OTs you guys know what it is that you're getting into, what your options are, so you can have a good idea of what the profession is like, and decide even for yourselves whether this is the right profession for you, and what track you want to pursue as far as OT goes. So this here is Dylan Callier, and he is a physical therapist, but he knows a lot about travel therapy, and I'm really excited to learn more about what he has to say. So, Dylan, tell us a little bit about yourself.
Yeah, absolutely. So my name is Dylan. I've been graduated about 2 years now out of school, out of PT school. I had this conversation with a friend right before I went to graduate school, and I found out this term called travel therapy. And it really sparked my interest. And at the time I was kind of, I was living on a friend's futon because I couldn't quite afford graduate school. And so I'd live on this futon and I would sleep there.
Expensive.
Yeah. And I'd go back home on the weekends and work. And during my evenings, I would read this book, and it's called Vagabonding by Rolf Potts. And Vagabonding talked about being able to travel the world and see all these things and do all this cool stuff. And before I read that book, I always thought that, to travel the world, you had to be rich. You had to be, one of the few. And what I found out after reading that is that that's actually not true. You can actually travel very cheaply, and more so now, even with cheaper airfares and things like that, and more accessible. So I found out that you can actually travel as a therapist within the United States. And basically how that works is that if a place is in need of a travel therapist, you can go and fill that need. Usually the contracts are about 3 months long. And usually, it's not like the military where somebody tells you where to go. You actually get to choose where you want to go. So if a contract comes up, you can decide to take it. You can decide to leave it, do whatever. You're completely autonomous on where you want to do, where you want to go, what setting you want to work. So it's a really cool thing. So I worked for a friend very shortly after I graduated, and then jumped into travel therapy and headed out west to California. So for a kid that grew up in a town of 2,000, this was like that cliche Hallmark story of getting out and going on adventures. But that's kind of my background in travel. Starting out, I'd been wanting to do this for 4 years. When I first looked into it, there's hardly anything out there. There's a couple of blogs, but really where I got most of my information was from my recruiter, the first ones that I called up. And we'll talk a little bit about that in a bit. But recruiters are very biased, and I didn't find out until maybe a year later that some of the persons I was talking to weren't quite the people that I should have been talking to. And so now, when I was in between travel and graduate school, I started a podcast, and I got to talk to all these different travelers, including Laura Latimer, who created a business called Nomadicare that is actually kind of the integrity police of the industry. So before Laura came along, who's actually an occupational therapist, she traveled for 8 years. Most inspirational person I've ever met. Before she came along, the industry was very used car salesman-y, and people were getting not paid what they were worth because as the business models, we'll get into it, there's a lot of secrets that are kind of held. And so there was a lot of blind spots that if you didn't know the industry, you could easily be taken advantage of. And so we now work with this company to help support travelers to have the most success that they can, and also protect them in many, many different ways,
Mm.
including to know which clinics to go to, financially what they're worth, how to make sure what's acceptable treatment, what would be asking too much type of thing. So we really help them navigate through this travel world. And we do that for basically if there's a position in a hospital, there's a traveler for that position. So nurses can travel, occupational therapists can travel, PTs, the guys in the lab, radiologists, technologists, the ones that are doing like the imaging and stuff, physicians can travel, nurse practitioners, everybody is needed somewhere. And so any healthcare position can travel.
That is so amazing. And I would kind of like to hear a little bit about your experience as to how it was that you said you were talking to some people that you probably should have not in the first place, and it kind of didn't it led you astray, I guess you could say, a little bit.
Yeah.
So can you tell us a little bit more about that?
Yeah, absolutely. So I think for the pre-OTs out there, the big thing that I didn't realize is that I first coming in, I did think it was like military, to where you worked for a company, and they sent you out to wherever you were needed. But that's not the case, and you actually get to choose. So the current business model is there's a hospital that is in need, or a facility, outpatient clinic, home health, whatever it might be. And then you have the traveler over here. But because the hospital is in such need and there's so many different travelers, there was a big need in the industry for somebody to kind of coordinate all the different travelers to all the different hospitals. And so these staffing agencies popped up. So now you have the hospital, you have the staffing agency, and you have the traveler. So what happens is that the hospital and the staffing agency decide on a certain amount to pay per hour, and then the staffing agency pays the traveler. What the staffing agency then has a choice to make is to let the traveler know how much they're making per hour. A lot of companies don't do that. A lot of companies are actually upheld by contracts that they sign with the hospitals, that they're not allowed to share that information. But that's where the first kind of level of like curtains and shrouds and shadows kind of comes along. So you don't know how much that you're actually making from that company. So that's why the industry was really needing relationship-based travelers, to where you have a recruiter that you can trust, and so that you don't end up in a position where you're working with somebody else who's earning potentially $500 more a week than you, like another traveler I spoke with about 2 weeks ago. So that was one of the things. Two, there's a lot of different marketing tactics that these staffing agencies will do in order to persuade you to work with them. So they'll use things like, oh, we'll give you free housing, or we'll give you free transportation. Pretty much anything that they say is free is actually coming out of your bucket of money. So if they say, we'll give you free airfare, all of a sudden you're thinking like, oh yeah, this is nice. I'll do first class. I've never done that before. And then it changes your decisions once you know that it's actually coming out of your bucket of money. So there's a lot to go in with that, but just know that a certain amount goes towards the staffing agency, the remainder goes towards you. And if they give you free housing, it's actually coming out of that remainder. If they give you free transportation, it's actually coming out of that remainder, which means that there's
Wow.
less for you to go towards student loans, to go towards, buying that car, saving for that house, saving for the engagement ring, whatever it might be.
So what would you say are some of the reasons that a pre-OT, OT student should consider travel therapy? Why travel?
So travel therapy for me is a really good solution to me feeling monotonous. I get antsy. So if you get into travel, one of the jokes is that most of the contracts are about 3 months, but there are facilities out there, mostly in the really popular areas like San Diego, that want you to work about 6 months. And those are like oh my gosh, that's way too much commitment for me to stick in one area for 6 months. But so for travel therapy, you get to see and you get to learn a lot of things that you wouldn't have done as a permanent job. You are expected to perform in the first week. The longest orientation I've had in a setting has been 1 week for a traveler. And that's the longest. So the quickest has been 2 hours. And when you go to a facility for a permanent facility, usually it's like 2 weeks. If you're working somewhere like a special hospital or in the ICU, it'll be, 3 months. If you're doing a residency, it's even longer. But for a traveler, you're expected to show up and start treating patients right away. So you get to learn how to be very adaptable because you get to see all the different systems, different hospitals, and you get to learn all these different documentation styles. And you get to work with other clinicians from a lot of different areas in the US. And so coming from PT background, I know that Indiana has a very hard focus on certain styles and musculoskeletal conditions versus like California, where they're a lot more holistic. And so you do get to see the differences and the kind of culture changes, even though that it's inside the US.
Very interesting.
Yeah, and it's a cool way to try out different settings too. And so therapy, one of the cool things that we get to do is that we can actually transition pretty easily between settings. So I went from outpatient to home health very easily, but if you are a nurse traveling, you have to settle down somewhere for a year before you can actually do that. So for us, it's if you're like, oh, you're coming out of grad school, and it's like, oh, I really like pediatrics, but I really want to do this. Therapy is a good opportunity to kind of try out those different areas and see the country at the same time. So as my sister's a nurse, she works and works and works, and then she gets 2 weeks off in a year to go see Yellowstone. But
Wow.
I get to go there and do it on a weekend. And so that's some of the perks that you get to do is, if the opportunity arises, you can go to all these awesome places that otherwise small town kid from Missouri wouldn't have been able to go see.
That is so amazing. So what would you say? Now, I have a tough question for you.
Mm-hmm.
What is your favorite thing about travel therapy?
Favorite thing. I used to think there's this feeling that you have. The very first place I went to was actually as a clinical student. I knew I wanted to do travel, and so one of the tactics to do that is to make sure that you can actually handle being away from your family, being away from your friends, going to a town that you don't know anyone, living with strangers, and then working in a clinic that you don't know anyone. You can do that with clinicals. So you can do that with field work. And so what I did is I went to Birmingham, Alabama, and went to the sauce factories. And it was a short 5 weeks, but that was like my favorite spot because there was so much emotion. There was all these adventures I went on, these hikes in the red rocks and the red dirt. And then my first travel contract out in California, I remember seeing the big windmills when I finally got to California and seeing the desert and it was an actual desert. Like I'd never seen a desert before. And there was mountains in the skyline, which I'd never seen before. And that feeling I thought would be my favorite, but it actually isn't. It's the people that you meet. And I have friends that I only see maybe once a year. And they are the closest friends to my heart right now. And a lot of them are travelers as well, because when you meet other travelers, you have to be kind of outside your comfort zone and talk to people.
Yeah.
And when you meet another traveler, it's like all the barriers are just dropped and you become best friends instantly. And so a lot of the people I consider my family right now are travelers as well. And so you can also, if you're interested, follow PT Adventures.
It becomes like its own little niche.
Yeah. Oh, for sure. 100%. Yeah. We all go to a conference called Travelers Conference once a year, TravCon. And that's where I learned how to be a traveler. But you meet, 1,500 other travelers.
Wow.
And,
That is so cool.
Yeah. And so for persons that, stay permanent, it's hard to imagine to, kind of pack up your bags and move every 3 months or live out of a suitcase, kind of like I do. But for me, it would be hard for me to settle down somewhere. And so that's kind of, the people that you meet is definitely my favorite thing. And then you make friends in that area and you can always come back and come visit. And when you're driving through, you have the memories again. But those are my favorite parts.
Okay. So I have another question for
Mm-hmm.
you. What would you say to those pre-OTs, OT students that are listening to their professors,
Mm-hmm.
listening to maybe even their close friends, and they say, no, you can't do that, like, what are you thinking? Like, you're just straight out of school, like, you're only going to get oriented for like 2 hours. you know and you're
Uh,
expected to treat right off the bat, like, you're a new grad, what do you know? So what do you have to say to those pre-OT students that really have this itch and are antsy to just go travel, and they want to experience all these different settings, all these different states, and they feel like they can't do it because they're a new grad.
right, right.
So,
So that was very similar to the experience I had when I was coming out of school. And I had my quote unquote second mother through grad school that really helped me out. Basically took care of me from my freshman year of undergrad all the way until I graduated with my PT degree. And I would go and tell her that, hey, I want to do this travel thing. She's like, and she was supportive, but she would have all these like horror stories of like, well, we had this one student that tried travel and blah, 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 blah. And then they ended up coming back and never doing it again. Or like, it was always something dramatic like that. And what I found was that when professors tell you that, it's not just to be mean or to say like, we don't believe in you. It's because they've had previous students have bad experiences with it. And if you look at the market and something that is interest, so what I do with my role now is I talk to a lot of CEOs, I talk to a lot of recruiters and travelers and persons that have been in the game for a while. And if you look at between like 2008 all the way until like 2012, 2013, there was a really big dip in the market. And so when a dip happens in the market, it means that there's less jobs. It's really a lot more competitive. And so you don't get that opportunity to choose where you want to go. And if you are a new grad coming out of school, you're working and you're applying to this job for this contract in San Diego and Phoenix, like wherever you're trying to go, and your resume lands on the desk at the same time as a really experienced OT. Think of like somebody you look up to. The person that they're going to call first is going to be the person with more experience. So that means that you have to keep playing that game of this versus this, this versus this, and eventually you win. But if you don't have the opportunities to kind of say no or the options to say no, then you're kind of stuck with whatever that opportunity might be.
mm,
In those instances, you usually, and when opportunities drop and the jobs are low, facilities are more likely to cancel on you as well, because that usually means more permanent OTs are ready to take the work as well, or more PRN in the area are ready to take the work. And so when professors say that, most of the time they're remembering what happened when they had other OT students traveling during that period where there was a market dip. And there was a market dip for everyone. It was in 2008 was when we had a big kind of like Medicare rechange. And so everything just kind of went low. Hospitals got really conservative with their money, as they always do when the market changes, or as they always do when the healthcare system changes. And so then it slowly kind of came back up. Things were good for a while, and now we're going into another Medicare reform that's going to start in October or September. And so we're seeing the same kind of trend. So certain professions are starting to slow down, and certain professions are kind of staying the same. So nurses are about the same. OTs are starting to slow down again because this is going to be hitting a lot of the SNFs, and PT is doing okay right now. So as of now, the market's not very supportive of a new grad traveling. Not saying that you can't do it, but there are ways that you're going to have to do it in order to be successful. Those ways, if you are doing your field works, try and be as diverse as possible. Some schools will force you to do this, some schools won't, but being diverse is really, really important, because if you can do 5 field works in a row and handle that documentation and pass, you're much more likely to be a success than somebody who's been working at the same job for 2 years and got just really good at, say outpatient, or got really good at home health, and then now they're trying to bust into the SNF world or something like that. They're going to struggle. So you being a new grad is actually a good thing, because you're used to bouncing around and having all these different things that you have to keep up with. Once you get out, you want to look at which states have the most jobs. Again, you want to try and avoid that job that you can't say no to per se. So in SNFs, that's where we see a lot of the ethical dilemmas that kind of happen with productivity and things like that.
Mm-hmm.
So you want to California is most of the time the best state to go to for all professions. A year ago, again, the market changes all the time. A year ago, OTs were hot. OTs were doing really well. And Texas was the place to be. Now, Texas is very dry and there's hardly any jobs there. And so it's important to know that if you're a pre-OT watching now, 2 to 3 years is going to be very different. It could be that OTs are the really hot ones and that it would be the best time to travel as a new grad. Right now, PTs are pretty good to travel as a new grad, but if this trend keeps going down, it will get to the point where the market won't support new grads to travel. But it's not because you're a new grad, it's because it's just going to be tough to travel in general. And then the persons with more experience are going to be the ones that land those positions.
Very interesting. Thank you so much for that information.
Ooh, I have one more point, actually.
Yes, please do.
So this is, I do a lot of school presentations as well. And this is what I usually like to bring up, especially if there's professors in the room. The idea of mentorship is a very hot topic right now for OTs and PTs and all speech therapists as well. But mentorship isn't a traveling problem. Mentorship is a therapy problem. So if you looked at my what I received as a new grad PT working for the clinic that I worked for, I didn't really get mentorship. I got like a ramp up period, but that was about it. And they kind of just let me go and do my own thing. And what we're finding is same thing for the clinics that I work at. I got brought on, had a week-long orientation. I was like, wow, this is amazing. Like this is like triple what I'm used to. And then I realized that the other permanent person came in behind me and did the exact same thing. So they only got a week of training before they were expected to be at 80% caseload as well. And so it's not so much will you receive mentorship on the road, will you receive mentorship at all? And if you want mentorship and that's something that's keeping you from traveling, you need to make sure that you're doing it correctly straight out of school. And so you want to make sure that's in the contract. If it's not in the contract, it's not going to happen. So if you don't have a formal orientation set up where you're meeting with your director every Friday going over whatever, or you have that ramp up where you're like, oh, first 2 weeks I'm going to be at 60%, and then the following 2 weeks I'll be at 75, and then after that I'm expected to be at 100. As long as it's formally set up with numbers, you should be good. If you're doing an interview and they're like, yeah, you'll watch some videos on the computer and you'll kind of like shadow some people, and then by second week you should be good. That's not going to be an orientation.
Yeah.
So that would be my rebuttal to that for professors saying that it's not good to travel as a new grad. There are more settings that you're more at risk to running into those ethical dilemmas, or that is more autonomous, which is a little bit more scary. So home health, you're kind of on your own. It would be better to have a bigger orientation during that, or like the ICU. But if you stick with a setting that you're really comfortable with throughout your field works, you should succeed straight out of school.
I'm glad you said that, because it's so true what you said, that the fact that you are a new grad actually makes you a better candidate in a way, just because you have that flexibility already, and because you are used to bouncing from field work to field work, and you were learning about peds and you did peds, and then you ended up in geriatrics or outpatient ortho or like whatever it is, and that actually works to your advantage. And if that's something I think that you should remember if this is a route that you want to take as you guys embark on this OT journey of yours. And so thank you so much for that advice. And please also, I 100% agree what he was saying about mentorship. It's a therapy issue, which is even why I started this platform. Even though it is geared toward pre-occupational therapy students, my goal is not just to meet your needs as a pre-OT and then you guys are like, all right, Jess, bye, thanks, I got into OT school, thank you. No, I want you guys to reach out to me once you're in OT school. Like, hey, look what I did. I'm in this field work now and I'm loving it. Like, let's keep that relationship going. Like, that's what I want with you all if you're a part of my group. And share as you guys get into OT school, please share your experiences with the pre-OTs that are in the group. You guys were there, and so yeah, so that's one of my goals. And but yeah, I want to be there for y'all throughout the journey. And I know that I make calls with some of you all. I do Zoom calls, interviews to get into OT school, those mock interviews and stuff like that. So yeah, mentorship never ends, guys. And so I have another question.
Mm-hmm.
There are a lot of students out there that may want to do it, but they're like, but I I'm kind of like scared to leave, and they're kind of like they're on the fence because they're kind of scared to jump out of their comfort zone. What advice would you give those students that are just they want to do it and they want to seek the experience, but they are scared to leave their family and friends behind?
Absolutely. Well, first I would say that's 100% normal. So me, before I jumped in, I was planning this for 4 years. I still remember packing up my car. It was sleeting at night. I had to redo it. Like, not everything fit. Bring it all back out, put it all back in. It was miserable. Woke up the next morning, kind of hopped in my car, put my hands on the steering wheels, and I was like, what am I doing? And I just got the job with my friend that I really, really loved. Leaving my family, leaving grandma, leaving my nephews, leaving my friends, and just to drive somewhere that I've never been before, and didn't know what to expect. And so I would say those feelings of like, that nervousness of jumping off the fence is 100% like normal. So you're gonna have that. The second part is one of the reasons I will never tell somebody not to travel, especially as a new grad, is because the longer that you don't travel means the longer that you won't travel. So if you, like, I was going to travel, was all set for it, and then had this other opportunity that I took, and I knew if I kept going and working and being around my family and being around my friends and getting used to it, the longer that I stayed at that one job, the less likely that I was going to travel. And so if you don't travel and you're saying, oh, well, once I learn this, or, oh, once I feel comfortable in this setting, oh, once I do this, the more often you do that, the less likely you'll actually go out and travel.
And
Go ahead.
well, I was just gonna say, I feel like a lot of this advice too even applies to the pre-OTs that are looking to go to school out of state.
Yeah, definitely. And once you do it once or twice, it's really not a big deal. And I remember having that conversation with my family. Actually, it wasn't my parents. My parents were super supportive. My outside family, a big farm family. My dad had 9 brothers and sister. My mom had 6. And they were like, "You realize once you get out there, you're not going to know anyone, right?" And it's like, "Oh, I didn't think of that." Like, it was like completely bizarre to them. But the last thing. So we talked about it's normal to feel that way. It's the longer you stay on the fence, the longer you're going to be sitting on the fence. If you get into it and the market's bad and you just can't find a job, or you get into it and it turns out like this isn't for you, you really wanted to be back home. One of my best friends, she traveled without her fiance. She got into it. She's like, I can't do it without him, type of thing. Like, you can always go back. So the risk of like, the risk is very minimal. You can always go back to what you were doing before. But I don't know very many people that have jumped into this and didn't enjoy it. And I know a lot of people that jumped into it saying we're only going to do it for a year and then we're going to buy a home and then we're going to settle down, like travel couples, relationship goals, whatever. And they get into it now. They've been traveling for 4 years and they're like, we're not going to stop because it's so great. And I think the other part that traveling really helps with is this issue of student debt coming out of school. So as a traveler, you do get compensated more usually than anywhere else working in the U.S. You also get, if you qualify for them, tax-free money. So that's less taken out of your paychecks. So more that you get put towards student loans, or more that you get to put towards investments, whatever it might be. Um, but it solves so many different issues. It's also a really good way to kind of just, again, if you're trying to figure out where you belong, or maybe we're seeing a lot of clinicians start to travel after working at the same place for 2 to 5 years. Again, they struggle more, surprisingly, unless they stick in that same setting. But usually when they get out of that setting, there's a reason, and they don't want to be in that setting anymore. You can call it burnout, you can call it whatever you want, but they need change. And so this is a great way to do a change. And so travel, I think, is an answer to a lot of different things that's going on in the therapy world right now. And I truly, truly love it and really enjoy it. Not only that,
That's
but
awesome.
the patients that you treat are much different. When I was working in rural Missouri, turns out I had a whole bunch of Parkinson's patients, or patients with Parkinson's disease, and would have never called that. It was just a rural clinic, and we kind of treated everything. And then once I got to California, it's very a lot more like musculoskeletal stuff, like things like you would think of like traditionally with PTs, but really random surgeries, and a lot of things that you would think would be very rare, but then these surgical procedures keep popping up, and so you become really good at that one small surgery that you were told only happens 1% out of like however many conditions. And so you get to hone in your skills as well and learn that way. But it also forces you to be, if you're in this group, it forces you to be a little bit more savvy and educate yourself to where you're not relying on the permanent person that you're working for, or the permanent staff. And so you're going out of your way, you're finding those online mentors, you're finding those groups to follow and belong to, just to answer your own questions, because you kind of have to when you're in this field.
That, yeah, it's true. What advice would you give these pre-OT students that are looking to get into OT school? Like just general advice in the sense of, yeah, what helped you when you were applying to PT school? You know, it's still along the same realm in the sense of our struggles are the same, you know, of wanting to get in, dealing with rejection letters or like applications. And so, yeah, what advice would you like to give the pre-OT students in the group?
Oh, that's really good. I think with it reminds me of a story, or of a situation where when I was making that switch from outpatient to home health, a lot of therapists are doing that right now because home health pays more. That's kind of where, as this new Medicare shift is going on, hospitals are discharging sooner. So patients are leaving the hospital sicker than they ever were before. But they're not ready for outpatient. So they're kind of stuck in this in-between zone. So we're seeing an increase in inpatient rehab, and we're seeing a really big increase in home health. And so we're having a lot of therapists go there just because they know they can get paid well. And so when you're in those interviews and they ask you why you want to be an OT, that's a really important question, because they want to see the passion behind your decision, and not just say that, oh, I just did it because, whatever the other decision might be. They want to see the passion behind you. So when I had that interview, it was because I had friends that were outpatient PTs that were kind of burning out and wanted to try something else, and did home health and loved it. And I talked about how you get to be autonomous. I talked about how you can do one-on-one with patients, all these things I was really excited for. And yes, the being paid more was a perk. And yes, listening to podcasts on my drive was a perk. But those weren't the reasons why I was doing it. And so when you're in those interviews, I think that the interview for me was what got me in talking about that passion and talking about your stories. I think stories are so important. And so if you have somebody that you've seen, or somebody in your family that's been personally affected and their life was changed by an occupational therapist, I think home health, just going back to that, is the need for OT is so high, because you'll have a patient who hasn't been able to shower in her own home for 3 years since her husband died. And you'll see like these really upsetting stories, and you're like, oh my gosh, like there's such a huge need here. And talking about those stories is really what's going to make you stand out, and stories are memorable. So I would say get your passion down, get your why down, because that's going to be a question that you run into for those interviews, and it's a very important question.
Thank you so much. Yes, I 100% agree. And actually, now that he was actually mentioning to know your why, I do have a video up on YouTube about knowing your why. Go look it up. I believe the title is Knowing Why You Want to Go into OT School. So, yeah, I can't agree more with that. And not only that, I think if you know why you're doing something, it it makes you less likely to burn out, because it just keeps you going and there's something for you to work towards, and it makes your communication a lot clearer as to why they should even accept you, and your passion comes through. So I think that it's so pivotal for you to know why it is that you even want to get into OT in the first place. And my hope with all the interviews that we have done these past few weeks throughout all these different settings is that it will show you that, number one, our careers as OTs is not linear. There's so much that you can do, and that if you think out of the box, you can make your career exciting. Whether it's through travel, whether it's through creating a platform to help pre-OT students, or create a podcast and platform for people that are wanting to do travel therapy like Dylan has. Like, there's so many ways that you guys can impact the profession, and you don't even have to necessarily already even be a therapist to even start getting yourself out there for that. Like, occupation is stuff that we do every day that we can take for granted, whether it's reading a book. So what does that mean? You guys can probably start just, I don't know, thinking outside the box here, but even like a reading group for young youth around your local area. Like, if that's what you like, it'll make you stand out. So, but that's what I have to say about that. And I just also want to, thank Dylan so much for being a part of the show. And I hope that you guys enjoyed it. Once again, if you guys have any questions for Dylan or myself in regards to travel therapy and how it works, he has, his own podcast, which please give us all the info, show us how it is that we can follow you, and what it is that, how it is that we can basically see your journey as a travel PT.
Yeah, absolutely. So first, I would say something specifically for you guys. You guys go to nomadica.com and search up the market stat pages, and you'll see kind of what I'm talking about the markets changing, and they do rapidly change. So here in 2-3 years, it's going to be completely different, but that's a way for you to monitor it. And that will be the most important information for you to decide, should I do this after school, or should I wait? Or if it's something in your blood, at least you have a resource to go to know how to do it successfully, correctly, and give you the best opportunity to move forward. Two, if you want to see my journey, which started out with just me talking to other travelers before I even traveled, you can look up New Medical Nomads podcast. It's on YouTube if you like video. It's on iTunes, Spotify if you have a lot of long car rides back and forth from school, back and forth from work. And then, yeah, if you guys have any questions, feel free to reach out to me on Facebook, Instagram, whatever. I'd be happy and love talking travel. So just let me know where you're at in the process, where you're at in the world, and how I can help.
All right. Thank you so much again, Dylan. I really, really enjoyed hearing about this. So I will catch you all next week on the live. Have a great day. All right.